And I like this to be this side so that I can see all the lovely faces. Otherwise, sitting there, I just can see the speaker, which is also a lovely side, but this gives me a more wider picture. So I'm very happy to see all the smiling faces, and I hope none of you go to sleep during my lecture, because I think it's a good, important topic, and India is fastest. I think is it already the diabetes capital, or is on the way?
It is.
Something like that. So, as acupuncturists, we have a very big task. I remember attending one conference in Delhi, acupuncture conference, and at that time, like, somebody had presented on acupuncture in diabetes, and like everyone was up in arms. What do you mean diabetes can be cured by acupuncture? How can you say such things? So, don't worry. So, how many of you believe acupuncture can actually cure and not just control diabetes? Can I see a show of hands? Oh, like hardly, I would say 10%. Good.
Cannot be cured or can be cured?
Who believe that acupuncture can be only controlled? Everyone knows it can be controlled, but cannot be cured. How many of you think that it can be actually cured and not just controlled? Put your hand up. Still the same, around not even 10%, right?
So they don't believe.
They don't believe. Good. That's the audience I want. Like, if you already knew, then what's the point? So now let us just see a few testimonials. So just to get your faith up, otherwise only the 10% will be listening, 90% will be like, it will be bakwas kar raha hai. So let's see just one or two very short testimonials to bring up your faith.
I'm Vinisha Dalal. I work with NMIMS SDKM. Recently, I got identified with high blood sugar and I'm already obese. So my friend Mitra referred me to Dr. Yogesh Kodkani. I'm taking acupuncture treatment as well as sound therapy with the doctor, and I'm seeing a lot of change. My blood sugar medicines have reduced half in about 5-6 sessions itself, and I'm seeing inch loss also happening. I'm feeling calmer, better. I've been guided by giving diet chart and what suits my body type from Ayurveda perspective. So in all, I'm quite happy with the treatment, and I hope to just get out of the blood sugar medicine and also become lighter from weight. Thank you.
So, patients generally, you give them a diet chart, they think it is Ayurvedic. Our approach is entirely based on acupuncture, on the elements. So it's not about Vata, Pitta, Kapha, or like somebody may think any diet or any thing, generally they think of Ayurveda, but it's fully based on acupuncture, which you will see in the presentation. There's one more. You got it.
I'm Sandesh Shambar. I'm a pharmacist by profession. Since last 23 years, I have diabetes, and since last 3 to 4 years, I am on insulin. Morning I take nearly 20 units, evening I take 8 units of insulin. And after starting this treatment of acupuncture, I felt my sugar went down. I checked myself, and over a period of time, might be around a week, I thought that sugar has come down. I checked it, and then I stopped taking insulin. So thank you very much.
So it's like about 28 units of insulin stopped completely, and you still, we met him many times later. It's almost a year, and now he's still off it. So it is possible to cure. Now, after 1 year of stopping, if you're still fine, I think, I hope.
No medicine?
No insulin at all.
No, not
He didn't continue after that.
But
In some medicines we had to,
medicines-
medicines were, some medicines were, we had not replaced anything. He was already taking medicines, plus he was taking insulin. The insulin part completely got taken off. Medicines, he was, being a pharmacist, he was happy with them. he continued, and to date there is no issue. So that had he continued, medicines also would have gone, like in the first patient we saw. Already in 4 or 5 sessions she had already not come to harm. So it is possible. I hope now some people believe, if some belief has gone up, then kindly, can I have a show of hands again? Much better. Thank you. At least double now. Little, 3 times. Okay, so we'll start the lecture. Yeah. So, till now, I used to talk about 10 types of diabetes. Now there is little upgrade, now I have 12 types. So I don't know whether it's upgrade, downgrade, whatever you want to call it. Now 12 types, so more scope for treatment. And yeah, next question. So what is diabetes, first of all? Anyone? I don't look at this, please. Quickly stand up and tell me what is diabetes.
Lifestyle.
No, what does the word diabetes mean?
Sugar.
Huh?
Miscommunication in 3 organs.
Basically, what does diabetes mean? It means there's this excess loss of fluids. Okay. Second line. Diabetes simply means there is excess loss of fluid from the body. That's it. That's what the word. So diabetes broadly classified as there are 2 types: diabetes mellitus and diabetes insipidus. Okay. In the diabetes mellitus, what is the difference between insipidus and mellitus? Mellitus means something like honey. So if earlier days, when there was no lab, there was no what is this, Thyrocare and whatnot, Fadke lab, this, that. They used to still diagnose diabetes, and they would how they would do by tasting it. Please don't start puking. I know you just had lunch, but that's how it was earlier days. Now you are safe. So earlier days they used to taste the urine and see if it is sweet. They used to say it is diabetes mellitus, and if it is insipid, tasteless, they would call it diabetes insipidus. So what is the difference? In diabetes mellitus, there is excess loss of sugar from the urine. Okay, and the other type, there is just water, more water, and it is the second type is because of what the first type is because of. We'll see in the other slides. But what is this type? Let's get rid of it now. Diabetes insipidus. What happens is there is a deficiency of antidiuretic hormone. It's a hormone which is secreted in the hypothalamus and secreted by the, which is actually generated in the hypothalamus and secreted by the posterior pituitary. Okay, so even this can be treated by the way nicely. We have acupuncture. We have a point in the ear, the ADH point, for both the hypothalamus and the pituitary, and gives wonderful results. So even this diabetes you can start treating. Though this is not the subject of this lecture. Let's go to the next slide, please. So, what is diabetes mellitus? That is what we commonly call diabetes, and it is a, it's a metabolic disorder characterized by high blood sugar levels, right? And what are the reasons? Either the body is not producing enough insulin, or the insulin is being produced, but it is not enough. And then there is something called resistance to the insulin. All these things lead to high blood sugar, and which is what we call diabetes mellitus. So in general, all of you must have heard these 2 terms, type 1, type 2. In my practice, initial days, it was the same thing, what the books would teach us, SP6, LI4, LI11, this, that. And yes, people would get some difference, some reduction in their sugar levels. But this was subject to continuation. This is what was known as control. People were not getting cured. Later on during my practice, as I researched on the pulse, and I developed my own system called the Ashtadha Nadi Vidya system. I was able to differentiate diabetes into 12 types. So, next slide. So, these 12 types are still a part of either type 1 or type 2. Okay? They are not something coming from some Mars or Venus. So, type 1 has actually actual deficiency of insulin. Type 2, insulin is normal or increased, but still it is inadequate, right? These are the two types. Now we'll see the differentiation of each of these types into 6 types each. So, these are the type 1 6 types of type 1 diabetes. So, in these 6 types, this order 1, 2, 3, 4, these are just random. It could have been 5, could have been at the place of 1 or anything. Don't go by the order, just understand what it means. So, in the first point, what I have put is that there is a general overall deficiency. You can feel it on the pulse. In the pulse, the pancreas is the right side of the spleen. So, the spleen pulse, if you divide it into 2 halves, you know where the spleen pulse is. I will not go into that. On the right side, you feel the right pancreas. On the left side, you can feel the left pancreas. So, in that, you see that energy is deficient in the right pancreas. Then there is another type in which, in the same pancreas pulse, the right side of spleen, you see what is called as dryness pulse. These are patterns which are very easy to understand, very easy to learn. So there is a pattern which is called a dryness energy, and it is seen in the right side of the right spleen, which indicates, what does it indicate? Dryness means that it's not getting enough fluid, it's not getting enough blood supply, it's not getting enough heat. So basically there is a blood deficiency in the pancreas. The pancreas is not getting enough blood, so it dries up, and what you see is this kind of a pulse. Then there is another in which there is an excess of wind energy. So there is a wind pulse which is seen in here, and which indicates that glucagon is excess. Now insulin is normal. You know there are beta cells and alpha cells. So alpha cells secrete glucagon, beta cells secrete insulin. So this glucagon, if it is excessively secreted, what is the function of glucagon? To increase the sugar in the blood, exact opposite of insulin. So if there is this pulse is seen in the this pulse is seen in the right spleen or pancreas pulse, what it indicates is that there is excess secretion of glucagon, which is causing the sugar to go high. So it's not that the insulin is deficient, it's normal. If you check it, it will be normal. In this case, I'll mention further what investigations can tell you how to determine. So then there is another, the fourth one over here is showing coldness. So when I see this kind of a pulse in the pancreas portion, what I understand is that there has been necrosis. Any condition you know which can cause necrosis of pancreas? Very severe pancreatitis. Then after that, when the person comes after surviving, pancreatitis is it's an ICU condition. So after surviving, if a patient comes to you, you see this kind of a pulse where the pancreas is practically destroyed. All functions of pancreas are destroyed. The endocrine, the exocrine, everything is destroyed. The patient is already on pancreatic enzymes and is already on insulin and everything. So this pulse is seen, is called a coldness pulse, and everything is destroyed in that. Then there is a pulse which is seen as heat in pancreas. So this is now the person is in actual chronic pancreatitis condition or maybe acute also. And it affects overall endocrine, exocrine functions of the pancreas. And that time when there is excess inflammation, there will be also increased secretion of various enzymes for a short time. And later on, the pancreas starts going down. So then there is another condition called autoimmune, which attacks the beta cells of pancreas that are destroyed by antibodies. Now in this, what happens is, So far we are talking about the right side of spleen, right? Because that is representing pancreas. Now we shift to the left side. Because immune function is governed by the left side of spleen. The left spleen, the actual spleen, what we know as the spleen, that governs your immune functions to a great degree. And in this condition we see dryness pulse. Next.
Which pulse you see?
Dryness pulse in the left spleen.
Left side where is spleen?
In the spleen, vertically you have to divide it into right and left, and the left side. So like you have the spleen pulse here, right spleen and left. So this now is something we can, yeah. So this will be useful for you because I'll be talking about how to detect these different types of diabetes, even if you don't know pulse diagnosis. If you know, it's very easy. If not, you have to do certain tests to understand what is this condition. So if there is in the first condition what we had, so deficiency of energy in the pancreas, so then insulin in the blood will be low, there will be no antibodies. If you check against beta cell, you do these tests for beta cell and insulin, you will find that they are clear. Glucagon will also be deficient because whole pancreas is now affected. So USG will be normal, but here in this case, you will not see any necrosis of pancreas or anything. So you know it is not a coldness type of thing. So in this condition, what is the simple treatment? You have to tonify the fire and earth points of right spleen, that is SP2 and SP3, and you also use SP6 of course to just balance out the energy. So this is how you treat a deficiency of energy in pancreas. The second type, there is dryness in which we had discussed there is dryness excess in right spleen. So insulin level is low, but there are no antibodies against beta cells or even against insulin. Glucagon is also low. So the first type was about energy deficiency. Second type is about blood deficiency. There is not enough blood supply. So in this, you will also see that the patient has generally dry skin, dry hair. USG will show shrunken or fibrosed pancreas. On USG, you can diagnose this condition. It will show that the pancreas has shrunk, the size is reduced, and it might show fibrosis. So in this condition, what would you do? You will sedate the metal point on the right spleen. You want to reduce the dryness. You did the metal point on the right spleen, tonify fire and earth. So what are the points? They are SP5, SP2, and SP3 tonification. SP5 sedation, SP2 and 3 tonification, and SP6 will still use it for balance. Then there is, we talked about the high glucagon picture, the wind excess in pancreas. Glucagon levels in blood will be high. You can check them. Insulin levels will be low. Why will they be low? You know, yeah?
Comparatively.
Comparatively low, yes. But why? You understand it through your 5-element cycle because these are opposite energies. If one energy goes high, the energy which it controls goes down. So the humidity energy basically, which is responsible for creation of insulin in the pancreas, that will be low because the wind is high, the humidity will become low. That is, if the food energy is high, obviously the earth energy is going to go low, right? So treatment, what would you do? Sedate food. This obviously is in your right pancreas. Sedate food, tonify earth. So what is that? SP1 sedate and SP3 tonify. And in all these conditions, use SP6 of course. That helps to balance out. Right. Next. Yeah. So the fourth type of type 1 diabetes, in the fourth variety, what we have is coldness excess. That is where the pancreas has got severely damaged. And USG will show necrosis of pancreas. Insulin, glucagon, pancreatic enzymes, all will be low. So if all of them are low in your test, you know that it's a condition of coldness in the pancreas, in which what are you going to do? Sedate the water point, tonify the fire and earth points of right spleen. And which are they? SP9 sedate, SP2 and SP3 tonify. Right? Then you have earth heat in pancreas. So here you can, there are various tests. Nowadays we have something called thermography. It will show redness, more excessive blood supply. And pancreatic enzymes will be high in the blood. Insulin, glucagon will be low because too much heat does not allow these endocrine functions to function properly. So in this case, what you have to do, sedate fire, tonify earth, and the points are sp2 sedate and sp3 tonify. Then lastly, as far as the type 1 is concerned, we have dryness in the left spleen, right? So it is an autoimmune condition. Antibodies to beta cell will be present. Insulin will be low, glucagon will be normal because only those cells which are producing insulin, they have got affected. So what are you getting here? Insulin low and glucagon will be fine. So what you do here, now you work on the left spleen. You sedate metal, tonify fire, balance sp6 and sp5 sedate, sp2 tonify and sp6 balance. So this, if you know this much, you are able to treat what is called type 1 diabetes, which people consider absolutely incurable and which people think that insulin is a must. So they say, okay, type 2 diabetes, no problem, medicines. Type 1, insulin. Right? Everyone got this? But here we just busted the myth. So type 1 is also curable. And if you know how exactly, if you know what to treat, how to treat, you can do it. Yeah. Next please. So having done away with type 1 diabetes, now let's talk about type 2. So type 2 diabetes, again 6 types. Generally people say diabetes type 2 generally is because of stress, right? A lot of people say that type 2 diabetes is mostly because of stress. That's why I've taken it as number 1 here. So in this case, the humidity, the kidney pulse will show humidity, energy, and this type of diabetes is because of high levels of corticosteroids, especially the glucocorticoids causing high levels of glucose. Because these glucocorticoids, they are secreted in stress because when you're stressed means what? What is stress? There's something about to attack you and you want to fight back. Your muscles need more glucose. Protein it needs to build up big, but when actually fighting comes, you need glucose. That's why you see all these athletes running, they are not having protein drinks that time, they are having glucose so that they get energy. So this is what is required, this is what your body needs during stress. And the body is made in such a way that during times of stress, it gives you what you need. So glucocorticoids increase the levels of glucose, and these are not controllable by the normal levels of insulin because they are in a very high level. There's so much stress, so much glucocorticoids, such a high level of glucose being pumped into the blood that the normal levels of insulin, even slightly elevated ones, they are not able to control it. And so the person is having diabetes. So that is one case. Then you have a second case here, high level of heat in general and specifically in kidneys. So yeah, naturopathy people like to love to talk about this. Everything is because of high acidity in the blood. Yeah? Buy one of those alkalinizer 3 lakh machines. They just love this. They think everything is because of just make the blood alkaline, everything will be fine. But they are right in this case. This is an isolated case. There may be other cases, but definitely they are right here. But for only this type of diabetes, not the others. So high acidic condition causing denaturation of protein structure. We know that anything, you take a piece of plastic, you take a piece of metal, you heat it, it might melt, change shape. So heat has the property to change any shape, right? Even somebody having too much heat, even his shape changes because then he eats more and shape becomes so like that. So heat has the property to change shape, and you need to reduce this heat from the body, right? And what are the main organs for which we will work on? Kidney, because kidney has got supposed to have coldness energy. So original energy is that of water which is cold. So you need to tonify it so that whatever heat is getting generated is counteracted and removed from the body. So in this case, you need to work on the kidneys. And the next case, what we are talking, is also very common cause of diabetes I have seen in my practice, type 2 diabetes. This is because of humidity in the liver. Now what is humidity? Earth element. Earth element causes what? Fatty liver. So basically when we eat something, what happens normally, or the sugar that is created by the digestion of carbohydrate, it just gets absorbed either by the liver or by the muscles. So if the liver is already loaded with fat, there is no space in it. So where will it put the glucose? Because it has to make glycogen out of it, liver glycogen. If there is no space, then it can't go anywhere. So the liver says, no, sorry, mera pet bhara hua hai, tum aur kahin jao. So then doctors, what they tell, take a walk after food. So then the muscle, the blood supply to the muscle is increased, more blood glucose enters into the muscle, and the muscles then convert it into glycogen. So this is a way of controlling blood sugar. Walking after meals is not a cure for diabetes, just a way to control, because the problem is somewhere else. Right? So then let's move to the fourth point, which is dryness in the left spleen. Again, we had spoken about the same pulse earlier, but in that case what we had seen, there was antibodies against the beta cells. So the beta cells were being destroyed, insulin production had gone down. That's why it was type 1. But here, insulin production is normal, but the antibodies are attacking the insulin in the blood circulation. So this is type 2. Insulin is there, but it has been attacked. And when it is attacked, its shape changes because something is attached to it. An antibody is attached to it, and it has kind of nullified that insulin. So insulin will be there, but it is useless. It's a useless kind of insulin. So they are inactivated in circulation due to the antibody. Let's move to the fifth type. So these are the two ones which I recently added. So wind in heart and small intestine, like glucose is, because glucose is wind, and heart is related to veins and small intestine to arteries. If your blood sugar is high, it can also be because of excess wind in these two organs. Because heart, if it is high, then obviously veins, you take blood from the veins. So if it will be high in the veins also. And the last type, wind in stomach. So basically, the postprandial type, what is it? How fast your sugar enters your blood. There are two types of tests. We have the fasting blood glucose, and we have the postprandial. So what is the postprandial? It checks how fast your sugar has entered and stayed up. So if a person has got wind in stomach, then this can lead to faster emptying of the stomach. This glucose which is there can enter into your small intestine faster and get absorbed, and you can get a big spike. So these kind of things will be more seen with those continuous glucose monitors. Immediately after eating, they will see a spike. After 2 hours, maybe they may come down. So your postprandial may not show so much, but your spike immediately after eating will be very high in this condition. So these also contribute to your diabetes, not yours, generally. Yeah. Okay. So let's go into details of the type 2 and how to check them using lab parameters. So if the humidity in kidney, that kind of a pulse is there, what you will see in your lab will be high levels of glucocorticoids and slightly elevated levels of insulin, because insulin will still try to overcome, but it will fail. Adrenal gland secretes corticosteroids during stress. So in this case, what you need to do, of course, as my dear friend Chirag was talking about mind. Mind is most important. Person, you can do the treatment what he has suggested for reducing stress. But in this case, the physical treatment will be to reduce the earth point sedate the earth point of kidney and tonify the water point. So K3 sedate, K10 tonify. This will be on the physical level. What my friend Chirag has spoken is on the deeper level, is the mental level, to which you can add meditation, you may add other things, and that's how you can. But this is something very specific. Any case of diabetes, you tell him do meditation, it's not going to work, because that was not the cause in his case. Where it is a cause, it has to work. So if stress is the cause, then meditation is definitely one of the important treatments. The second type, that is 2.2, what we have is high level of heat in general and kidneys, which signifies low pH of blood. So normal and high levels of insulin will be there in this case. So lab will show you what? Low pH of blood. What will the lab show you? It will show you normal or high levels of insulin treatment. And how do you treat it? You can tonify the lungs also, because lungs are equally important for throwing out carbon dioxide. If carbon dioxide is in your blood, obviously it increases your acidity. So carbon dioxide will go out, and also you tonify the water of kidneys so that kidneys are able to throw out the excess heat from the body. So in this case, what are you going to do? You are going to tonify lung 8 and you want to tonify kidney 10. You have another condition in which there will be high humidity, what we spoke about, the fatty liver, right? That person, how will you understand that this person belongs to that type? Obviously, is going to be obese. Fatty liver patients are usually obese. And on USG, the fatty liver will be clearly seen. So what you do here, you sedate earth and tonify wood in liver. So L3 sedate and L1 tonify. This helps to cure your patient of fatty liver. Next. We are on the last three types now of type 2 and overall also. So we had seen one type in which there was dryness in the left spleen, the autoimmune condition was there. Antibodies to insulin will be seen in the blood test. Level of insulin in the blood may be high. Treatment will be to simple treatment for most of autoimmune disorders. Most of the autoimmune disorders, not all, but most of them, a majority of them are because of dryness in the left spleen. So this is not only related to diabetes, it is about generally a large number of autoimmune disorders. If you do this, the autoimmune disorder gets corrected. There are certain other conditions which I have come across where the autoimmune stems not from the spleen but from other lymphatic tissues. It can be the thymus, it can be the Peyer's patches in the small intestine. These are rare. But most of them I have seen. I mean, this is the first thing I look out for when I come across an autoimmune disease. First thing I try to see whether does he have dryness in the spleen. If he has, then fine. It's done. As good as cured. I want to get rid of it. So in this condition, what do? You sedate SP5 and you tonify SP2 and SP6 will do to balance. Then the wind in heart and SI heart. What will this person have? Will have a high resting heart rate. Will have flatulence in the abdomen if SI is involved. Encapsulated gas. The gas is in the stomach, so sometimes it comes from above, sometimes down, and sometimes it just stays stuck. So these symptoms can give you an idea that this could be the condition causing maybe borderline diabetes in this patient. So you can correct it by sedating the wind points, that is sedate H9, tonify H7, sedate H3, tonify S4, SI4, SI3 and SI4. So you can have still the last condition which I mentioned, wind in stomach. There the person, if it is in the stomach, so the gas comes from above only. High postprandial sugar as a spike and normal fasting sugar. So in this condition, sedate ST43 and tonify stomach 36. So this will help you to cure I am told you cannot use the word cure, but I am sorry. You can actually cure. So you can cure type 1 diabetes also and type 2 diabetes also. And I hope we have understood. These are the main things. Now let's go a little further just to polish up things more. Yeah. So as Dr. Komal Dalal mentioned, you have to talk about limitations. Otherwise nobody takes you seriously. So I'm happy my daughter came out with these two things yesterday so that I can sound more credible now. So there is something called LADA and there is something called Modi, not Modi DI or DY. So what is LADA? The latent autoimmune diabetes in adults and autoimmune destruction of beta cells. It is called latent because destruction is slow and steady. So I think this one, we will still come in the autoimmune disorders and still be cured, only you will have to find out. Because I have not personally come across this condition. Somebody has not come, I have got LADA. So I don't know. Maybe he was not diagnosed or whatever. So if somebody comes to me saying that I have got LADA, then I will know whether the dryness is in the spleen or some other tissue. Right now I don't know, so that's my limitation. Number 2, maturity onset diabetes of the young. Now this is a genetic condition which causes the beta cells to malfunction, to eventually get destroyed. So it's a genetic thing, it's not autoimmune, and the onset is usually after age of 25. Now genetic disorders, I believe acupuncture in the extra ordinary vessels, there is some mention that they can be cured. Personally, I have no experience, so this is my limitation. And yeah, so I think we spoke about not 12 but 14 types today, and you got more than you bargained for. I said it's 12 types, but we have 14. So that's another pat on my back, really. Next, please. You're already here. Glycemic load. You heard these words? So we had one slide in which I will find out and send it on the thing. It's about different foods. What are the glycemic indexes of that, and what is the glycemic load? Anyone knows about these two words? Yeah.
If the glycemic index is high, then the post, as soon as you consume that food, the blood sugar level goes high.
What is load?
Glycemic load is
Yeah. So there are two things, glycemic index and glycemic load. Glycemic index means how fast your blood sugar rises after eating that particular food, and glycemic load means how much total glucose is going to put in your system in whatever time. The total amount of glucose that is going to enter after eating that in whatever time, slow, fast, whatever. So I had this slide in which it was showing all these different differences. So certain foods have high glycemic index but low glycemic load. So quickly the blood sugar will rise, but overall glucose is not much. So in this condition, what will happen is suddenly you will get a spike. But it is not going to really contribute much to your
HbA1c.
HbA1c. It's not going to make a much big difference in that. That will remain because overall glucose has not gone more. But you still might show a quick PPE rise at your glycemic, what meter is it called?
CGM, continuous glucose monitor.
Continuous glucose monitoring. Continuous glucose monitor, CGM. That device will show a quick rise. So you need to know about all these things, and you have to see what exactly is the problem with this person. Accordingly, you have to choose those foods which can give benefit to that person. So also we had discussed about various other things. Generally, there is a misconception that diabetics should be taking Karela. How many of you believe diabetics should take Karela? Okay. So definitely Karela has got some hypoglycemic chemicals in that, substances. It does reduce. But as we have seen, many types of diabetes would be caused by dryness excess. Karela has the property of dryness, creating dryness. So those people who have this kind of thing, we stop them from Karela. Instead, if they have dryness excess and they have heat deficiency, we suggest jamun for them. Jamun has got more heaty power and it also reduces. There are other hypoglycemic substances also, foods like methi is very good in those conditions. People who have got low humidity, right? Those where the energy of the pancreas was low. Overall, pancreas energy is a humidity energy, spleen energy. If that is low in such cases, using ladyfinger seeds, ladyfinger soap, these are good because they provide humidity. They help to improve and they have got hypoglycemic power. So that way a person needs to check and differentiate different foodstuffs and give the right kind of a food. So during the treatment, try to give the person low glycemic foods. You can just check the internet or you can wait for us to send you the slide. In that case, you need to give for some time at least the person should follow low glycemic index foods and low glycemic load foods so that the body gets a chance to correct itself, regenerate itself, and a person can be actually cured very fast without any ups and downs. So after this, we have got patient this case. If we have time, otherwise it's okay. Okay, thank you. After this, there was some slide which showed different pictures of pulses in different people. It's little difficult for people to understand. So it's fine, we'll leave it at that. But I hope you have understood everything. And if there are any questions, I'm happy to answer.
So one patient case can be elaborated on.
Yeah.
One patient case can be elaborated on.
Okay.
Please stand up, please stand up. Yes, please.
One patient case can be elaborated on.
At least one case is in elaborate. Okay. So in this case, what we are seeing that his spleen has got dryness, his pericardium has got humidity. What does this signify now? Pericardium humidity signifies mental stress. So this obviously is going to be transferred to the kidney eventually. The stress is going to create. At this point, it is in the mind. When it's already in the kidney, it means that it has become physical now. From the mental, it has become physical. So in this case, the treatment would be to treat the dryness of the right spleen and also to reduce the humidity, the anxiety from the mind. In this second case, what we are seeing is that in the right side, you have got humidity in the liver, and this means that this condition, this person definitely had type 2 diabetes caused by fatty liver. These other things what we are seeing are more or less, in the kidney also, in the one left kidney we are seeing humidity, which is also suggesting type 2 diabetes because of stress, glucocorticoid secretion of the left adrenal gland. So when we are seeing writing kidney here, in case of diabetes, what we are talking, if there is humidity, we are saying that the adrenal glands are excessively functioning, leading to high glucocorticoid secretions. So maybe 1 or 2 more, and then we'll end. Yeah. Then in this condition, what we are saying is spleen, there was dryness. So which type? Right spleen dryness, which type of diabetes?
Type 1.
Type 1. Type 1 diabetes. Here we are seeing wind in the small intestine also. So again, it is a type 2 also. Many diabetes, nothing, it's not always type 1 or type 2, it's a mixture a lot of times. Even if a person comes to us saying that I've got type 2, And when we check, we find that his right spleen is also deficient. We know that he is also type 1 plus type 2. And we have to treat both these factors. Yeah. So I think we'll end here. I think you all of you got the idea. Thank you. Some questions. Can I take a question? Yeah.
Sir, what should be the...
Who is this now? Please stand up.
Please stand up and ask your question.
You are asking. Okay. Why so little? Okay.
So one
Yeah.
question, what should be the duration of treatment, for how long the patient should be treated, and the treatment session should be taken at what intervals? Can we accept the patient every day, and how, at what interval the patient should be checked for blood glucose?
Yeah.
These things.
Yeah.
Thanks.
So generally, it is my practice nowadays that first 3 sessions I give in a row. 3 days in a row I give. After that I call alternative. And I recommend that after 3 or 4 sessions you have to check your blood sugar. If you don't, then I'm not going to treat you more. Because I don't want your sugar to go down and something to happen to you. Then people are going to blame acupuncture even the acupuncturist will got hypoglycemia and he died. That should not happen. So I want that after at least 3rd session or 4th session, or whenever earlier also if the person feels hypoglycemic symptoms, he has to check it. So generally we saw, you must have seen in the testimonials which were shown, that within 5-6 sessions also a person gets tremendous difference. So once this is done, like it may take 12 sessions, maybe taking 15 sessions, some to get rid of the whole thing. But after that, a person can keep a follow-up of a weekly, fortnightly, monthly. And after that, when everything is still normal, there's no more need to come. So the whole treatment can take anything between 2 months to 3 months.
Who decides to change the medicine?
We prefer that they consult their physician and accordingly, and the physicians do reduce the medicines. But if a person tells us that no, my physician is out of town, you want to come after 3 months, then I say, then sorry, you have to get it reduced. I cannot have you on insulin, taking into the same dose of insulin and something will happen. Yeah.
How do you use CGM?
CGM is wonderful. We tell our patients. We recommend it to our patients. Because we see fast results, we like that it's better that they know what's happening. And the thing is, very important thing is that when you're treating anything for that matter, diabetes is just one example. So if you're treating a certain person and the person is on some allopathic medication or maybe any other, maybe Ayurvedic also for that matter, if a person does not reduce the dose in time, then defense mechanisms of the body start coming up to raise the blood pressure. I mean, to raise the blood sugar. Blood pressure also has the same principles. That's why by mistake I said blood pressure. If a person is taking treatment, don't I like to live on the edge.
Yeah, likes to be on the edge.
So, if a person I'm treating for blood pressure, for example, and if the blood pressure goes down, and the person says, no, I cannot stop medicine, doctor told me that lifelong you have to continue, then the person will start getting low attacks of low blood pressure, right? So such people, I have to tell them that if your doctor is not reducing, you will have to reduce. Slightly, I will tell you how to reduce. Or
Because you are a
can.
doctor.
Yeah. Because I am a doctor, I tell them that I am also MBBS, you can do. Or you go to somebody else, go to some other doctor and see that the person reduces. Because if you don't, in the case of sugar, if a person does not reduce, what will happen? Every time there is hypoglycemia, you will go and eat some sugar or some chocolate and this and that and again raise it, which defeats the point. We want to get the person off insulin, we want to get the person off and oral hypoglycemics. We don't want the person to just go down and come back using some kind of sugar and stuff. And what will happen in this case? The body will treat this as a stress, and there will be an internal stress mechanism which will release more glucocorticoids and that pulse will change now into kidney utility pulse, which was not there earlier, because this person is not listening, not obeying the order to reduce medicines. Because the person is getting repeated hypoglycemic attacks, the body will now try to secrete more of glucocorticoids and keep his blood sugar high. So this is very important. The person has to be very on his toes as far as reducing medicine is concerned, as and when required.
Any more questions? Yes, please.
So if you see that the diabetes is getting better and the person is off his meds, do you still recommend that they take the foods that you have recommended all their lives? Do
No.
they change their
Yeah.
nutrition or go
Good
back?
question, very good question. So, diets, whatever we give, are never meant to be lifelong. For whatever disease, they are meant to be taken for maximum of maybe 1 month after they are cured. After that, they have to go back to normal food. If they don't, then they will come back with some other disease caused by imbalance, because certain foods are recommended which are opposite energy. Those energies will go high and they will develop diseases caused by those energies. So they have to go back to normal foods. Yeah.
Yes, Dr. Toli.
For long study, you should zero blood sugar for 6 months, after 1 year, stopping the
So the person should come now, sir.
Now, there is some people you should try.
That is the biggest problem.
That is a-
With allopaths, they continue for 10, 20, 30, 40, 50 years. With us, once they are cured, they don't want to see our face.
Insulin dependent diabetes, difficult to convince that they are cured. Unless until after 6 months, 1 year,
Yeah.
2 years, we should the
So
blood
one
sugar.
of the cases which I mentioned, we are meeting him in marriages, he's eating all the sweets and everything is fine.
No, that's okay. But you should be the blood sugar.
Yes.
Blood sugar should be
So
the.
he's a pharmacist, he is very strict about checking his blood
in
sugar.
any
So
diabetes coma,
friends, I think we should conclude it. We have the next speaker. So the summary is point number 1. I think diabetes needs to be understood by the acupuncturist. Understand diabetes properly from both modern medicine viewpoint and acupuncture viewpoint. Okay, understand both the sides. The second most important point is, do not try to withdraw the medicines immediately. I have seen many times across many disciplines that, okay, you are starting my treatment, stop your diabetes drugs. Never do that. Okay, this is very, very important. Thirdly, you should be sure, because just like Dr. Yogesh just mentioned, that with your treatment, if the sugar is coming down and you are not prompt, that also becomes a problem. So the sugar is coming down with your treatment, you are not adequately balancing it with the reduction of the other doses, then the body tries to elevate the sugar which you are fighting. So you are creating a complex situation. And if you remember in the morning, this was the very thing I mentioned, that sometimes the acupuncturist can do more damage if they do not know how to balance the energy. So this is very important, and you can study the 12 pulses and the different manifestations of the 12 pulses. But as a summary, these are systemic disorders, lifestyle disorders that have a deep impact on the body. And to really cure it, you need to be very focused. Like Dr. Yogesh, you need to use your brains or use his brains and get the results. Okay? All right. Okay, that TV is not working.